Good afternoon, everybody, and welcome to this afternoon's Facebook Live. My name is Alexander Falcone, the Director of Emergency Management for the City of Coral Springs, and I'm joined here today by Dr. Peter Antevi, our city's Medical Director. It's been a little bit of time since we last joined you on a Facebook Live to present you with some information related to COVID-19 and also to answer any questions that you may have. So as a reminder, please, if you have any questions, you can put them in the comment field and we'll be happy to answer those here today. Recently, we've watched as the COVID cases have been on the increase, not just here in Broward County, but across the state and across the nation. Earlier today, our numbers in the state of Florida surpassed 97,000, and in Broward County, we surpassed over 11,000. Our goal today is to discuss what these numbers mean, what precautions you can take to help make sure that we are keeping this disease at bay, and also discuss some of the trends we're seeing in terms of hospitalization and other relevant factors for us to consider. So to start it off, I'd like to ask Dr. Antevi. Dr. Antevi, as we continue to see these cases increasing, we're seeing reports that we have less hospital capacity, and we're seeing reports that the COVID patient admittance is not increasing. So if you could please explain to us a little bit about hospital capacity, and what we can expect in the weeks to come as we start to see more and more cases of COVID-19 being confirmed.
Absolutely. Hi, Coral Springs. Peter Antevi here. As you all know, when we went into really complete lockdown, the hospitals stopped doing elective surgeries. They stopped allowing anyone in that didn't have to be there. And essentially, the hospitals were being reserved as essentially for emergencies only. And after the county opened back up again and the hospitals reopened their doors to elective surgeries and elective patients and all the people who had things that had to get done, and they put them off. Well, now the hospitals have filled up, not mainly with COVID patients per se, but just with the regular patients who needed to be seen, who needed operations, who needed procedures done, and who needed to go into the ICU. Now, I will say that we have seen in the last week or so, as we've all seen, everyone's following the numbers, I'm sure, an uptick in the number of cases. The number of people who are getting sick on a percentage basis, it has increased. And we now know that a lot of those folks are maybe in the younger category. Why is that? Because when we reopened up, who went back out? The younger people, those of us who have to go out and work. And I think the most vulnerable are still staying home, the elderly and those who have maybe other issues, who are diabetics and so forth. They're staying home and they're staying away. And so in this increase that we're seeing, Alex, everyone needs to understand that the virus is still around, but it's now infecting the younger people. And so if it's okay, I'd like to put up a couple of graphics on the screen so we can kind of at least go through some of the numbers, make sense of them. So I'll pass it back to you, Alex, and I'll share my screen while we do that.
Perfect. Thank you, Dr. Antevi. And, I know that a lot of our increased testing capabilities have resulted in a lot more confirmed cases. And so one of the first points that we can clarify is that while our cases are on the rise, and folks may, be quick to point that it's a result of increased testing, that's true. But that increased testing and those % positive returns are indicative of the rate of the disease in our general population. So as we watched in early May, we had roughly 3% of our tests were coming back positive. At one point, we were below 2%. Our % positives on our tests are now coming back at closer to 8% here in Broward County. And so with that in mind, Dr. Antevi, I was hoping that you could explain to our folks at home a little bit more why it's so important to keep our protective measures in place, why it's so important for them to wear their mask and take other measures such as social distancing that we've been discussing.
Yeah, I think you brought up a lot of good points. Can you see my screen at this point?
We can, sir.
Okay, perfect. So I'll go to the screen and then I'll go to the questions and your comments. And so here you see the total cases for the state of Florida. This is, again, a live dashboard. Total cases, positive residents, hospitalizations, and deaths. And then let's go to the top right here, You can see here that this is the new cases of residents by day, and you can see that upturn. At the same time, you can see that the death rate has kind of come down. And so what's important to understand is that thankfully less people are dying, and there's a few reasons for that. Number one is that we understand the virus better. So from the EMS side to the emergency department to the ICU, understanding how to treat patients, what tests to run on them, figuring out who's going to get sick, who has to be hospitalized, who needs the ICU. Once you get into the ICU, we're not putting people on ventilators as quickly as we would have before. We're using alternative measures within the hospital system. That's better. We now have remdesivir. That's better. We now have Decadron. That's better. We're understanding the virus and how to work with it better. That's number one. The second thing, though, is that we know that a person who gets COVID today won't really get really sick from COVID, probably not until day 11 to 14. And so now that you see the rise coming up, we don't expect to see the death rate come up. It lags behind the case rate. And so as you see the death rate has come down, that's all a product of what happened weeks ago. Now the case rate goes up and the death rate will follow within, let's say 2 to 3 weeks from that. So we do not want to see more deaths. God willing, no one else dies from this thing, but we know it's coming. And so let's kind of go into the next screen here, which I have here is for testing. And Alex, you just alluded to this. This is just for the state itself. Let me start here by saying we've tested a lot of people, and we've gotten 100,000 positives and 1,517,270 negatives. When you look at the percentage positive, there was a couple of days where people were saying we're just doing more testing. Well, that's not true. When you look at the positivity rate, there are more people who have the virus than they did before, and therefore the virus is back and never left, to be quite honest, and here we are. So if we want to go now and break this down on a county basis, I can go to Broward County, and you can see here, look at the Broward County positivity rate, and it was kind of low here in the 2%, 3% range, and now it's kind of come up here and more than triple just in a very short amount of time. Personally, I can tell you, my phone doesn't stop ringing with personal friends, family, business owners, community leaders, politicians saying, I need help. We have people who think they're infected, and indeed, it's coming. The last couple of weeks have gotten worse. So, and then Alex, what I want to do next, well, I think I've answered some of the questions, but I'll pass it back to you, and then I want to talk about hospitalization. So I'll give it back to you here for a moment.
Thanks, Dr. Antebi. And another question that we get a lot is when you look at the total amount of persons infected in Broward County versus the total population, the amount infected is actually less than 1%. And so oftentimes we hear people say, if 99% of the population is healthy or free from the virus, why should we continue to take any, protective measures? Why should we continue to require the wearing of face masks? And so I was hoping you could explain to us a little bit more about why that's important and what steps we can take.
I think it's a wonderful question, and I think it's a very important answer in that this virus doesn't watch the news. It's not red and it's not blue. The virus is a virus. It's not going to stop until it hits 60 to 70% of the population. That's when you reach the term called herd immunity. The problem is that, like Alex, you just mentioned, we're only at 1%. And in the large antibody study that we're currently performing, led here in Coral Springs, we're doing that 7 cities. We are finding that our infectious rate, our antibody rate, is only 1 to 1.5%. Indeed, exactly what we thought it would be. So what does that mean? It means that either until we get a vaccine or until the virus finds its way to 60 to 70% of the population, this is not going to go away. And so we now know that the way to stop this virus from getting, to mass produce, if you will, and just have so many people infected is to wear masks, to social distance. Well, I call it physical distancing because we're not socially distancing, it's a physical distance. We have to be 6 feet away, right? We now know, we've known this, we've said this from the beginning, that this is an airborne virus. And so you need to protect yourselves, number one. You need to protect the people around you. And the way to do that is by covering up. It's been now known that 97% of the people who've gotten the virus it's been indoors. So if you're outdoors, only 3% of the virus has ever infected people outdoors per the latest data. So we know that outdoor activities are much safer than indoor activities. And so I would really say to everybody, just look at our fire department. I'm going to knock on wood here, and I'm going to thank from the city manager, all the administrators, our mayor, our commissioners, but really right down to the fire chief and all the assistant chiefs. We have 0 firefighters infected with COVID-19. And why? It's because we put a policy into place of PPE. And people who are listening, we've come to your house and you've seen us in our gear, but at the fire station, 24 hours a day, 7 days a week, we're wearing a mask, right? We're cleaning the stations frequently. We're cleaning the back of the ambulance after every single time we have an issue of potential COVID patient. So we're taking those simple precautions. And I would say to the people listening, there was a 17-year-old death in Florida that I heard about yesterday up in the middle of the state. Don't get complacent thinking that you're not going to get the disease or that you're so young, that you're healthy, nothing's going to happen. That could be the case, but you may pass it on to a neighbor, a friend, a loved one, a grandfather, a grandmother. Again, the virus is going to get 60 to 70% of the people, or until a vaccine shows up. We just want that to happen in a very kind of plateau basis rather than on a spike, which is what we're seeing now. So Alex, I'll pass it back to you, and then I'll talk about the hospital capacities here in Broward County.
Thank you, Doctor. I'm actually going to take a question from one of our comments. We had a question about whether or not we will shut Carl Springs down again. And I want to address that in a couple of parts. First and foremost, we're in phase 1 of reopening here in Broward County, and that's based upon the federal guidance for reopening and the state's guidance to reopen safe, smart, and effectively. Our city commission has remained committed to making sure that our businesses and our business owners are provided with the opportunities they need to reopen their doors in a safe and effective manner. At this point in time, we are going to continue to follow the guidance of both the state and the county on their reopening plans as we make sure that our local businesses and our local community centers have the tools they need to open safely and effectively. As a city, we've helped provide masks, we've helped provide disinfecting sprays, we've helped provide opportunities and engagement in terms of grants and other funding opportunities so that we can continue to open here safely in Carl Springs. So to answer your question, at this point in time, no, our plan is not to shut down the city or to reverse course. Our plan is to maintain our current course, but really take a renewed approach and a more specific look at the safety measures each and every one of us can take to maintain that plateau that Dr. Antebi was talking about. I also want to hit on a point you mentioned, Dr. Antebi. We've started to see a reluctance in folks to call 911 or to ask for assistance. It's troubling data, but it's data that our fire department has been looking at over the last couple of weeks. I want to reassure our public and reassure everybody in the city that all of our firefighters and paramedics and our police officers are wearing personal protective equipment on every single interaction they have with the public. Why are they wearing this personal protective equipment? They're wearing this gear because it prevents them from catching and it prevents them from spreading COVID-19. Our goal is to make sure that every single time you need assistance from one of our employees, they are safe, they are healthy, and they're able to provide you with the services you need. So I'll reach out to everybody out there. If you do find yourself in need of assistance and you need to call 911, please go ahead and call 911. Our folks are healthy and they're ready to serve you. So with that, Dr. Antebi, I want to transition to discuss a little bit about the hospital situation. I've read a couple of articles about how the available bed space in the county is decreasing, and that can be troubling when you look at the increasing number of COVID-19 positive infections. Would you mind give us a little bit of background information in terms of how we determine available hospital beds and what it means for COVID-19? Are we expecting a shortage in hospital beds, or expecting anything along those lines?
Alex, that's a great question. And first, let me say thank you for talking about our fire department and our members of our fire department. I couldn't be more proud of this city and the leadership of this city and what we've done. And yes, we have seen folks who do not want to go to the hospital. They're scared. And I would agree with you 100%. We've done everything, I think, correctly, thankfully, and would reassure everybody that please do not stay home if you're not feeling well, chest pain, God forbid, or severe. If you need us, please call us. Now to the hospital situation. The hospital situation is being monitored very carefully because the first sign of trouble is when the ICU beds run out. Now, as far as ventilators are concerned, the state has done a good job of getting all the right equipment. Again, like I mentioned when I started, we're trying not to use the ventilators as early as we would have once we learned about how COVID works. I would say Broward County was one of the first in the country, and we've actually published some of our materials to actually understand that it's probably better to delay the ventilator as much as possible, and we're doing that. Let's go to the hospital situation. The state tracks every hospital, the state tracks every bed, and the state tracks every ICU bed. And it's right here available freely. And so what I'll do, I'll go to, I'll show you this screen here. This is a statewide number. And I will show you now, let's go to Broward County, and we can just go to our county. That's not our county. Let's go to Broward, there we go. I should have my glasses on. And you can see here that we can now look at the total number of ICU beds that are open in the county. And then we don't have to go too far to see the first hospital is Broward Health Coral Springs. And you can see that there's 55 available beds, 2 adult ICU beds, 5 pediatric ICU beds. And so this is a product of the fact that the hospital is reopened again to its regular day-to-day help that it was provided to the community. And Broward Health Coral Springs has been a great partner, as has Northwest and the other hospitals. We're very in close contact with them. If we just move down a little further, we can see Cleveland Clinic here, 22. And then we can come down here to Florida Medical Center, 5. And you can see where Holy Cross is at 5. And then if you want to come down to Memorial Regional Hospital here, you can see that there's 23, a large hospital with 23 ICU beds. So every hospital has a different capacity. Memorial Regional in South, the South Campus has no ICU beds available. So this is going to ebb and flow. And once there is that increased stream of hospitalized COVID patients, the hospitals will have to make a decision as to whether or not they're going to continue the elective surgeries. And I have a sense that at some point, and it may be for 2-3 weeks, maybe it won't be till the fall, God willing, but at some point in time, you're going to have the hospitals who are going to need to say, we're running out of room and we have to make more room. They're going to stop the elective surgeries, and then they're going to make room for this type of situation. I think in Broward County, we're so well organized, with a lot of smart people here. We'll do the right thing. And I think the cities, like Alex had mentioned, are going to try to maintain their current state and not have to kind of quote unquote close down when we know we can do the right thing without physically closing down everything. So Alex, I'll pass it back off to you, and I hopefully that that image showed exactly what that person was asking.
Thank you, Dr. Antevi. And I'll answer a couple of other questions that I'm seeing in the comments. One of the questions was about opening up basketball courts. As a city, we are working to reopen our parks. We're working to open those in a safe and efficient manner, and in guidelines, within the guidelines provided by Broward County and the State Department of Health. As Dr. Antevi just hit on, it's important for us to understand that the virus is not spreading as much in outdoor environments. And so we are taking that into consideration when we make decisions. However, while the virus may not spread in outdoor environments, if we are in close proximity to one another and people are sick, it certainly can spread in an outdoor environment. And so it's important for us to look at that as well. I'd like to close out our Facebook Live today by presenting a couple of numbers that you can utilize. The first is our community call center. Any updates or any additional questions that you may have, you can call 954-344-1001. That call center is a direct line to our city staff who can answer questions that you may have or put you in contact with somebody who has the correct answer. Another way for you to stay informed and to get updates directly to your mobile phone is to text the keyword Carl Springs, all one word, to the number 888-777. If you text the word Carl Springs to 888-777, you'll be getting direct updates from the city in the form of text message. And last but not least, if you have any additional questions that we haven't covered here today in this broadcast, you can comment them below this video, and our city staff will continue to answer these questions after we've signed off from this broadcast. Dr. Antevi, with that, do you have any other points that you'd like to add before we close out?
Yes, I see a question here about from Carolina about herd immunity. I think it's an important concept, so just real quick on that. Essentially that, let's say that the virus encounters a group of 5 people, and only one of those people, so one out of the 5, 20%, has already been infected. So now the virus has the opportunity of infecting those other 4, and then those 4 will give it to others and so forth. But if the virus encounters a group of 5 people, 4 of which have already had the virus, let's say 80%, now the likelihood of that virus hitting that single person, and that single person going and being in another group of 5 people and hitting that other single person, is much lower. So all herd immunity is that the virus doesn't have the opportunity to bounce around because most of the people it encounters already have it and already immune to it. Now, the question of immunity is a whole nother issue, and maybe we need a whole nother Facebook Live on that. I think the jury's still out on that. But all herd immunity is that there's a lot of people who have already been infected, and the virus just has nowhere else to go. So hopefully, Carolina, that explained it. And again, any further questions, I'm happy to answer offline. So thanks, Alex, and thanks everyone for joining us today.
Thank you, Dr. Antevi. And with that, we are going to go ahead and conclude our Facebook Live for today. We do appreciate everybody tuning in, and we look forward to speaking with you again soon. Thank you. Stay safe and stay healthy.